areas of the home. But a large amount of blood was found next to the coffee table. His son reports that the patient has been much more irritable and unpredictable and doing strange things over the last 2 months. Social history, he's a retired casino security guard. He lives with his son and his family. For the last year, following a house fire in which his wife was killed. He is a Native American, and he is Catholic religion. He smokes 2 packs per day, and he reports drinking 4 drinks per day. Was not specific as far as what kind of alcohol he drinks. His ER assessment was that he was alert and orientated ×1 to person only. His pupils were equal and reactive at 3, and he had no extremity weakness, and his gait was steady. His blood pressure was 92 over 72. His pulse was 58. He is in atrial fibrillation, and his respirators were 16. His O2 sat was 96 on room air, and his lungs were clear. He has 2 20-gauge IVs in his right lower arm. I'll go through, do a med order comparison here. So he is to be admitted to the medical services with altered mental status for possible closed head injury or stroke. He's NPO. He can have morphine 2 milligrams, IVQ 2 hours, PRN for pain. DIG is on hold until his DIG level is back, and he is on atenolol 25 milligrams PO daily, Lasix 20 milligrams PO daily, and Napril 2.5 milligrams PO daily, and he can have Tylenol 650 PO 2 6 hours PRN for pain or fever over 101. His IV is to be 0.45 at 100 an hour. His eyes and nose ordered, and vital signs neurochecks Q1 hour. He is to have a CT of his head with contrast, and he has a neurology consult. So the CT of the head is ordered, and they will come down to get the patient shortly.
It's scheduled for today?
It is scheduled for today, yes. And they are called, and they know about it. Okay, so they should be down shortly.
What about the consult one? When are they coming?
The consult was not made, so you'll need to call for that. Okay.
What was his last temperature?
His last temperature was 99.
And when did he last have meds? His meds?
He has not had any meds today. And
what time of the day is it now?
It is, it's now.
It's now.
It's
okay.
8 in the morning.
Right.
Okay. And I did not get a chance to do a medication reconciliation for him. So if you can go through his meds, this is just what was reported in our chart, our electronic medical chart. Okay.
So he got no meds in the ER?
He did not get any meds in the ER, other than some local when they were doing his repair of his laceration. He did have a chest x-ray in the ER that was normal. He had an EKG that showed atrial fibrillation. And
he's not on tele right now.
Let's pretend that he is on tele. Okay. Let's pretend that he is on tele. Okay. And it's being broadcasted to somewhere else, so you would need to call for a report, but that's all hooked up. His glucose in the ER was 110. And he had hematocrit of 44 and a hemoglobin of 12.2. His DIG level was done in the ER and was 1.5. His RBCs were 7. His BUN was 54, and his creat was 1.8.
I'm assuming we're getting a copy of this.
You are. Yeah.
Okay.
I'm going to leave this with you here.
Is he diabetic, or is he?
He is not diagnosed as a diabetic.
Did the hospitalist order a sliding scale just in case his insulin or his blood sugar gets out of whack?
No, that is not ordered at this time, nor are serial glucose scans are not
He
ordered at
doesn't
this
have
time.
a history.
He doesn't have a history of diabetes, so.
And what's his activity level? Is he bedrest, or can he get up and ambulate with assist?
He can ambulate with assist,
Okay.
yes.
So,
How does he urinate? Has he urinated
He has
at
not
all?
urinated, and he has bathroom privileges, but he does have
Okay.
INOs ordered.
So does he use the urinal in the bed, or he gets up and goes to the bathroom?
Whatever he
Okay.
wants to do.
Okay.
He hasn't voided for me, so whatever works for you guys.
Is there a bed alarm on, just in case to let us know because of his neurostats?
This bed does not have an alarm.
Okay.
Okay. So again, if you're going through this scenario, it's just kind of to walk through these orders and the things. So he has a CAT scan that's due and a neuro consult. Okay. And Dr. Steele did say he might stop in to check and see how things are going. Okay?
Okay.
All right. So you can kind of divide up, you know, who wants to do what. If one person wants to record, if one person wants to do vitals, if one person wants to do the respiratory or neuro assessment, however you want to do it. There's pen lights over there and a light over there. There is I think all the other supplies should be in here. If you can't find something you need, say, I need whatever, and then I'll grab it for you. Okay?
how's your neuro check?
Okay.
Vitals to read?
Alright, let's get it. Start first. Maybe an introduction first would be good.
Let's get there.
I'm good at it.
Hello, Michael. I'm Courtney. I'm one of your nurses today, and I have a team here that'll introduce themselves.
Hi, Michael. I'm Betsy.
That's nice.
Hi, Michael. I'm Inshira. How are you feeling today?
I'm not feeling good.
You're not feeling too
I
good?
hurt here.
You hurt up there. Do you know where you are right now?
I'm not home. I'm somewhere. I'm not sure.
Okay.
Dad, you know you're in the hospital.
I know I'm in the hospital.
Yes, you know you're in the hospital. I had to bring you here. We found you on the couch at home. There was blood all around the house.
Oh.
You didn't know where you were. You had this cut on your head, remember? On your forehead up there on the right.
Yeah, there is
Yeah.
something there, yeah.
Yeah, so I brought you into the emergency room so they could stitch it up. We were gone, remember, for a couple days?
Yes.
You were watching the dogs.
Did I trip on dogs?
I don't know. You might have, but you were just sitting on the couch. You had 2 cigarettes burning in the ashtray.
Oh.
I'm sorry, you are...
I'm Tom. I'm his son. Hi.
I'm Inshira. I'm one of the nurses that's going to be working with your dad today. Do you know what month it is, by any chance?
I'm not sure. I'm not sure.
I'm not sure the month. Do you know the day or the year?
I'm not sure about that.
I'm not sure. Well, can you give me your last name?
White horse.
Okay. And do you prefer to be called Michael or Mike?
Michael is
Michael.
fine.
Okay. Alright, Courtney's gonna get some vitals on you, okay?
Hi. What's that?
This is a blood pressure cuff, and what it does is it tells you how well your heart's pumping.
Oh.
Thank you.
Sure.
Okay, just relax your arm.
So they were telling me, I remember they were saying something about a CAT scan they were gonna do on him. What does that mean? What's that supposed to do for him?
It's a radiology exam, it's like an x-ray, but it takes pictures of his brain in slices. So the main purpose, as I understand, is just to be sure that there's no bleeding inside the brain. And be sure that
Because he fell and hit his head, right?
Correct.
Yeah, okay.
Yeah, and it's pretty fast, it goes really fast, it's like 5 minutes once they get in there and it's in and out. And,
Really?
yeah.
What time are they gonna do that, do you know?
That'd be a good question, maybe we should make a call and find out what's available for that.
Just gonna help Courtney out and get your temperature. I'm gonna put this right underneath your tongue, okay?
Hi, we have Michael, this is, we're on, let's see, what's our report? We have Michael Whitehorse, and he needs to be scheduled for a CT this morning. We're just wondering what your schedule is, or? 20 minutes, thank you very much. And any prep that you need at all from us?
Nope, it's briefing without contrast, so
Awesome. Thanks, bye. 20 minutes for CT. So he's going for CT in 20 minutes.
20 minutes or
So
how
he's
many?
20 now, so
170 over.
I'm gonna get his, see if he's taken any of these meds and what he's got. So, I'm gonna ask him, but I'll talk to him.
This isn't working.
Hi, Michael.
Hi.
My name's Sarah. I'm one of the nurses working on the team with everybody else today, okay? I just have a few questions I want to ask you. First of all, are you having any pain right now?
Just up here.
Just right there on your forehead? If you were to rate your pain 0 to 10, 0 being no pain, 10 being terrible pain, can you tell me how bad that laceration on your head hurts?
7.
A 7? Okay. Michael, I would like to know what medications you took this morning. Now, you're the son,
Yes.
so if you have any more information that you could add to that at all, that would be good. So, did you take any pills this morning, Michael?
I don't remember.
You don't remember? Okay. Do you help him with his medications in the morning, or?
Normally, he came to live with us because, my mom and him lived in a house, and he came to live with us about 4 years ago. She passed away, and then, their house burned down, and she died in the fire. And
Sorry.
I think it's probably, thanks, I think it was probably from his smoking, but I can't get him to stop smoking. And he leaves cigarettes laying around. I'm afraid he's going to burn my house down, too.
Yeah.
We got the dogs there. We can't be home during the day with him. He seems to be all right most of the time, but this is something that's happened.
This is the first time something like this?
It's the first time something like this has happened, where we came home and he's just kind of sitting dazed on the couch with this blood around the room and then cut on his forehead. He didn't know what happened exactly. He seems to think he might have tripped on dogs.
Okay.
But he's been pretty good about taking his meds.
Okay.
At least I think.
Okay. So, Michael, you don't remember whether or not you took your pills
No, I
this
don't
morning?
remember since I fell.
Okay. Do you have any ideas about any of the medications then maybe this morning or not?
The other one.
About not whether he took it this morning, but I know he takes like something for his heart.
Yeah.
I think that's a digoxin or something like
Okay.
that. I know he takes a Coumadin
Okay.
Wow.
because he's got this thing with his heart going on. This.
Atrial fibrillation.
Yeah.
If I show you a list, which
Sure.
you might be able to be more familiar, so
Alright.
you think he's taken
You
that,
take
Yep.
what
hypertensive
about the
medicine?
atenolol?
Oh yeah, that's something for his blood pressure. I think he's supposed to take that every day.
Is he taking
Supposed to
that?
take that every day
Okay,
too.
what about the
90,
atenolol?
let's break it
That
down.
I don't know
97.
about exactly.
familiar?
Not familiar with that one.
So definite on these three, not sure about that one.
Atenolol, Lasix, and digoxin.
Yes, and you think he also takes
And
Coumadin?
Coumadin, huh?
Yeah, the doctor said he had to take that because of
Give me a nice long
the fibrillation of his heart. She said it.
Can you make
I don't know,
them
they
close
said-
your eyes?
Be careful with this kind of
Hold your
stuff
arms
too,
up like you're
because you
holding a
can
big
bleed, and
surprise.
that's
Your
probably
eyes
why I found
closed.
blood all over the house. I
Do
don't know.
you have a med box or anything set up for him that he takes his pills out?
He
of,
has them
or
just
is
in
he-
bottles right on the counter,
Can
and
you touch your left
we were
finger to
thinking
your
everything
nose
was
with
all
your
right
eyes
as far
closed?
as that was.
Okay,
He's been
put
taking them
right
for a lot
arm,
of years.
your eyes.
170 over 100, left arm, 200 over 110.
Okay. And the other one with your eyes closed?
170 over 100 on the right, and what was that?
200 over
Okay, right here.
Now can you get my fingers a nice tight squeeze? Nice tight squeeze. As tight as you can. You're gonna try and. Okay, now can you pull me in? Pull in as tight as you can. As hard as you can. Now push out. Good. Do you have any numbness or tingling in your fingers or in your arms?
No.
Well, yeah,
What
that's
about
a
in your
tunnel
legs?
also.
leg,
And your legs or your feet?
no.
I'm gonna take a peek at your feet, okay?
Sucks.
Can you feel that?
Yes. Yes. Yes.
Yes. Any pain here? Tenderness here?
No.
I'm gonna slide your socks off to take a look at your feet, okay?
Did you get fetal pulse?
I'm going to go upstairs. Do you want your socks back on?
Yes.
Yes. So you like to keep your feet nice and warm, huh?
Yes.
You know, he keeps asking too, you know, about where his wife is, you know, and she's been dead for, 4 years.
He's a little bit disoriented right now. So.
Really?
Yeah, we're gonna have to.
Is that, do you think that's just from the fall, or?
I can't say exactly what that's from at this point in time until we have a little bit more imaging to back that up. So we're gonna keep evaluating him and try and keep reorienting him. That's probably gonna be part of his plan of care, is just to keep reorienting him to, where he is.
So I just keep telling him, when he says that to me, just tell him what's really real. You hear that? I'm gonna have to keep telling you that there, Dad.
She would come in. I was kind of measured.
Do you want the covers on, or are you okay?
I'm okay.
Okay. Courtney, did you do head to toe, or did you just do vitals?
I was just doing vitals.
Okay.
Did you get fetal pulse?
Yeah.
Do you get a temperature or respiratory rate?
Respiratory was, temperature 97. She's double checking respiration.
Or,
I got, yes, well, I got
for respirators?
Margaret's gonna double check.
So, I think we should probably give him the morphine, because the brain pain at 7 for somebody with those things.
Yeah, I got an 8.
Yeah. Of course.
Is this your name band here, Michael? That's not on your arm? All right. Do you have any allergies to any medications at all that you are aware of?
I'm not sure.
No? Okay. Do you know of any
I don't,
medication allergies at all? He doesn't have an allergy band on, but...
yeah, I don't know if they forgot to put that on him or not. They
Okay.
might.
Because we want to give you something for your pain. You can have some medication for your pain. Do you feel that you need some, since you said your head's hurting like an 8 out of 10? Do you want some medicine for pain?
Yes, yes.
Okay. All right. We can get some of that for you.
What did you say?
Yes.
How come Father can't eat?
How come he can't eat? We're going to do some diagnostic testing and things like that, so the doctor wants to keep him NPO. Sometimes you never know if they're going to do, a procedure, and sometimes the CT, they don't like you to have any estrogen.
Okay.
Just in case if he aspirates or he gets nauseous and then vomits.
So it's just for now then, because he was telling me he's hungry, so.
Well, that's a good sign.
Food?
Yeah, it's food.
Are you feeling hungry?
Can't eat right now though.
Can eat?
No, not until after the doctor will probably come and see you and look at your CT results, and we'll go from there.
I'm going to listen to your heart, your lungs, and your belly, okay?
Okay.
You should give us blood pressure medication before you use for CT, because it's allergic to this. And we should be giving those. We should be giving those pain meds and those.
Yes.
Quick question. Are you sure that are allergic to CT?
I don't think so.
What do you think, Craig?
I don't think so. Not, you mean as far as pills and things?
Anything at all. Like shellfish at all.
No, he's pretty much his whole life ate anything.
Ate
Never had a problem.
Never had a problem.
He doesn't know whether or
As he
not...
gets older, his appetite's not as good. But
That tends to happen.
I think it's because he drinks too much. I mean, he drinks all my beer.
Oh, so he drinks a
Yeah.
lot.
Drinks all my beer. Yeah, and he leaves his cigarettes laying all over the house. You know, sometimes they're lit. I'm afraid he's gonna burn my house down too.
Where's my beer?
Yeah, he asks for beer a lot. I have to tell him, Dad, you can't. It's 8 o'clock in the morning. Can't have beer right now.
I'm thirsty.
And then,
Well, right now, we're gonna keep you nothing by mouth, because you're gonna have a couple of scan stuff. So we're not gonna give you anything by mouth, because we don't wanna risk you aspirating into your lungs, like coughing it up and it goes down into your lungs, and then that could cause pneumonia. We don't wanna do that to you. We wanna make sure that you stay good health, okay?
I hear a bell.
Yeah, the phone is ringing, so, yeah.
I'm just gonna pull this up so I can listen to your belly.
Okay.
Hello?
Thank you.
Okay.
Pressing is still clean.
I'm just thinking he's gonna go to CT in 10 minutes, and his blood pressure goes.
She's on the phone with the doctor.
Sure.
she is,
He just got to
awesome.
the floor. He has a 3 centimeter lac on his forehead. His vitals right now are in the left arm. The blood pressure is 200/110. Rest scores are 20. Pulse, apical pulse is 60. Irregular.
Any pain when I touch your belly at all?
Times 1.
No pain.
Nothing?
We are waiting for the CT scan. They said they'll be here in about 20 minutes. Right now, he's rating his pain at a 7 out of 10.
How are you urinating? How are you
Yeah,
peeing?
check better than
Any pain with that?
the strength.
No
of the
pain.
arm is
Pain?
weaker, the sensations present in all
Okay.
limbs.
Okay. Have you had a bowel
And
movement
we're still
lately?
kind of assessing him and we're getting ready to give him some more.
I don't remember.
Don't remember?
No.
Do you feel like you have to
We
go?
have not gotten any labs back on him yet.
No.
No? Okay.
We do wait.
Oh, okay.
I'm gonna have you rotate on your side toward me.
ER labs.
This is wrong.
Stay there. His levels 1.5.
I'm gonna listen to your lungs in the back.
Oxygen is 12.244. BUN was 54.
Take deep breaths for me.
Okay.
Okay, you can roll back over.
Okay.
I've got,
Okay.
heart is, it's strong but a little bit irregular, obviously, because of the AFib.
Okay, thanks. We're supposed to give all of his meds except the DIG. We're holding the DIG, and the CT is going to be without contrast.
So I can't,
Yeah. Well, yeah.
can't find it. And if I can't, I don't know what it is. That's nothing.
Oh, you're fine.
If it's a tumor, yeah.
Most likely maybe.
Hi, this is Betsy. I'm the surgical. I'm calling about mental whitehorse. We just spoke with Dr. Steele, and his CT scan is going to be without contrast.
Yeah.
Okay. It was ordered with or without contrast, and when I read the lab values to Dr. Whitehorse, he was concerned about the
Okay.
pneumonia, and he wants it done without.
Do you remember where you are?
Thank you. Right.
Not sure.
Not sure. You're at the hospital.
Us?
Yeah.
Why?
You took a pretty nasty fall and hit your head. You don't recall that?
I heard that.
You heard there? Well, you heard there because you hit your head. Do you remember what month it is?
To give them all, except the DIG.
No, I don't remember.
Do you remember what year the year was?
Pharmacy.
We are in October 2000.
Sir,
not
number
there.
for pharmacy.
Today is
Yep.
the 13th.
Oh,
424-336,
Can you tell me your last name?
White Horse,
White Horse. And your first name is?
Michael.
And what's your birthday?
Hi, this is Betsy on the med search floor. I'm calling about Michael Whitehorse. We don't have any
It
of
was
his
in
meds
February,
here.
remember, Dad?
February
February 13th.
How long do you think it's gonna be? He's
How
gonna be
old
going
is
for his CT
65,
scan, and the doctor
remember?
really wanted him to have his
You know,
blood
there's
pressure
something
medication
different
prior
from
to
state
that.
on here. I just want to verify this with you. I have 8/14/46.
In like 20
Well,
minutes.
that's right. I was thinking of your
6 minutes now.
your father.
Mike.
Years ago.
Grandpa.
Grandma, yeah, you were the 14th, August 14th.
Wait, I just have a question real quick. Real life. Do you want me to change this?
We got a question.
Like, do you want me to actually change this and respike because this IV bag that's running is wrong. Do you want me to actually change it? I do. Okay.
We need pain or
Do you want me to
tenderness?
take that?
Where the
Check
IV
for you?
is?
No,
No, it doesn't hurt at all?
no.
No?
Actually, you know what? Can I just get some Nutrition? I just kind of want to. Somebody have some
Nope.
scissors?
No redness, no biting, no warmth.
You just have to wait here till they get done with all their work, and then they're gonna take it for a test. For a test, yeah, test your brain.
Mike, I'm just gonna take a look at your bandage here, okay?
Alright.
Do you hurt anywhere else on your head?
No.
Just that area?
Yeah.
Okay. Nothing in the back?
No.
Do I see any bruising behind the ears or anything? No. How's your breathing? Do you feel like you're getting enough air?
I feel good.
Feel good? Okay.
I'm just gonna flush your IV here, okay?
Alright.
You may feel a little bit of a sensation. Some people can actually taste it.
We don't have anything that was needed.
We'll see.
The doctor said that you needed him to take him.
Did it help? Did you ask him about coughing? No. Nausea?
No. I did,
Are you having any nausea? Feeling sick to your stomach at all?
Just hungry.
Just hungry?
Yeah.
Don't feel sick to your stomach though?
No.
Good. Are you coughing at all?
Once in a while.
Okay, when you cough, do you cough anything up? Like any phlegm or?
No.
No.
Can you toss my trash can, please?
Alright. Did you already ask him about this, Sarah?
About what?
Oh, sorry about that.
Is yours?
Yes. Like anything?
Yep, I asked that and thought last time. Doesn't remember. Okay, Kate, hand scans here. Let's go. What's going on with this patient?
He's saline locked at this point in time. His IV fluid that he had was incorrect, so I'm changing it.
Okay.
Do you want to just take him saline locked, or do you want me to run this line and set it up?
No, I need to have that running.
Okay.
So, what's his story?
His B1 and creatinine are elevated. He's a B1 of 54 and creatinine of 1.8.
Okay, and she called and told me that the contrast was held then, so we'll just do it without contrast.
Okay.
Okay,
We're still waiting for pharmacology to come up and so we get his meds.
okay, so I don't know him at all, can you tell me a little bit about him?
He wants to go.
Michael Whitehorse, he's 65, he's a patient of Dr. Steele's. He came in for altered mental status. He has a little laceration on his head.
Okay,
And doctor ordered the CT, so I don't know how much information you want to know every.
is there any
single
precautions
thing
that I
about
need to
him.
take? Is
He's NPO right
His
now.
follow safety precautions.
Okay.
He's on neurochecks Q.
Yeah,
hour.
Q1, he's not oriented. He's only oriented to self, not to place or tone.
Okay,
Any
He
allergies?
does have some weakness, I think in his, which side was it?
Which side did you say he had weakness?
Left.
The left side.
okay, alright, anything else I need to take care of?
He's on telly, he's AFib, and he's on telly.
Okay,
So, I'm assuming that we'll need to call them and let them know that we're taking him off for a little bit unless they somehow.
Oh, I can run that through the scanner, that's fine.
Okay.
Okay. Alrighty. So, caught. We're going to CAT scan.
Okay.
So, a couple of things. So you come in and you have this patient that has a laceration to their head, okay? And you're you gathered information from the ER, right? They give you a little bit of information. Is there any information they gave you that you kind of like are honing into right now?
His medications, I mean, we didn't know what he was like to his blood pressure's elevated, so
Okay.
call about that.
No, like I spiked the new bag. And
So what are you thinking about that?
Is that running?
No, I'm like, is there a reason why this would be on once I spiked it? Faulty bag. Is that real life, or is that part of the
It should be
scenario?
run. It should be run.
Okay, I'm like, unclamped everything. It's like not running at all. Okay, just wanted to make sure that wasn't part of it. I was like, no.
Obviously the elevated blood pressure, you might have increased, maybe some ICP going on. Okay. So what about the meds? So let's talk about his mental status first. Okay, so what is his mental condition?
He's got altered mental status. So, and we didn't really know about his medications at all. He wasn't really able to say whether or not he had taken his medications. His son had no idea whether or not he took his medications. So that's kind of, you want to make sure that you are focusing on that and asking the doctor. So we talked to the doctor if he wanted to still give the medication.
I was concerned since it could be that swallowing, so I wasn't sure about swallowing, and I asked if we had told the doctor about his neuro status, and we did, but the doctor was ordering NPO meds, so I wasn't that seemed a little bit contradictory to me.
Okay, so he's NPO, and then they're ordering PO meds. We're going to come back to the physician phone call in just a minute, but let's think about his.
It's running.
What the heck?
It's leaving.
Where did that come from?
Oops, no, that's the one she took off. I'm sorry I set it up there. And it leaked. It must have fallen over.
Well,
Can you just go spike that stuff that's back there? That'd be great. Okay. So we have a patient that's been at home. Let's think about the history, okay? Because remember, history is very, very important, right? So what do we know? What do we know for sure?
He fell
Yep.
at home. There was lots of different pools of blood scattered through, so obviously he probably didn't know he hit his head.
Okay. Anything else abnormal about his mental status?
Well, he's only partially alert and oriented to self. He doesn't even know his birthday at this point in time.
Okay,
So.
at this point in time, well, what other information have you been given?
In the past, he's been pretty self-sufficient at home. I mean, not like his son says that they've left him at home before, to take care of things. And so he said he was pretty able to function, didn't like to leave him at home. So I'm assuming that, with that information, he previously was more alert and oriented than he is now.
Okay.
But it seems like it's been a downward spiral, though, because his son said that he's worried because he keeps leaving cigarettes lit around the house, and he's afraid that's how his wife, like the fire with his wife dying.
Right.
And so possibly this has been an ongoing issue, slow decline with his mental status.
Exactly. And let's look back in the report. Okay. Key pieces of information in the report here. Okay, Betsy, kind of look through there and see if there's any other information.
Drinking.
Okay.
He drinks four things.
The alcohol thing.
So we don't know
That's
how
a
much he
concern.
drunk when he passed or fell, so he could have excessive bleeding because the alcohol cleaned the blood.
Yep. One more key piece of information that I think his son did offer as well. They do leave him at home alone. That's fine. But what else? What are some behaviors that he's been doing in the last couple of months?
Irritable, unpredictable.
Agitation.
Okay.
Agitation.
Okay, so
That
this
sounds like dementia.
is prior to the fall. Exactly. Okay. So now let's step back, okay, and let's go into the whole medication situation. Okay, what do we have for labs? We have a ditch level of what?
1.1.
High, low, or normal. I believe that's a little elevated.
That's fine.
Okay. BUN and creatinine is,
Doesn't have that 10-to-1 ratio.
so both of them are elevated. thinking like, you know, okay, so we're thinking that's off, but in our nursing mind, why is that off? Why is he coming in with a BUN and creatinine that's elevated? Now let's look at his PT and INR. He's on Coumadin, is he not? Is he therapeutic?
Can I walk by? Is that okay?
Yeah, just do whatever you normally would. Forget about the camera.
It's not on the med list and
That's why. At least not in these results, it's not. Maybe something else.
Coumadin, 2.5. Okay. So he's on Coumadin, and his levels are they what they should be for therapeutic? Okay.
Does he have a PGT?
Okay, his INR, I'll be the lab. So his INR is 1.0, and his PT is normal, within normal range. So
Anyone at Coumadin should be between 2 and 3.
exactly. Okay.
For INR.
So knowing that we have a DIG level that's elevated, and we have a PT INR that's within normal range, and we have a patient that has been, he fell at home, right? So let's just, you know, we got to kind of regroup here. Think about what has gone on. He fell at home. Last 3 to 4 months, his son reports that he's not acting normal. He's doing some different things. Is agitated, and so you kind of alluded to that maybe we're thinking dementia here. So he's simply, the gist of the story is that he's just here with a simple cut on his head. Yep, he fell, but at home, why did he fall? There's a lot more going on. So as a nurse, what do we need to do about that? Okay, so here we have somebody that lives with his son. His wife already got killed because he burned down the house, essentially. Okay, he's not taking his meds like he's supposed to.
You can have depression too. You might feel guilty.
Absolutely, absolutely. So those are kind of some of the things that we wanted you to think about. Also, thinking about safety, just walking into the room. So you picked up on the fact that the wrong IV was hanging, and then you go in and change that, and I don't know why that wasn't priming, but in real life, maybe the IV isn't going to prime. So what would you do? You know, you got to roll with it, get another IV tubing or something. You walk in, he's a fall risk. The side rails are down. He doesn't have an ID band on, and things like that.
I didn't know if we were really supposed to put that on, like, actually just now, like, or if you were just kind of keeping it on.
Yeah, because Sarah had noticed it
like,
wasn't on.
Right. So that's the way it was supposed to be. But let's think legal and ethically, okay, he is, you know, when you're checking your patient identifiers, he doesn't have an ID band on. So how do you know?
And he's got altered mental status.
And he has an altered mental status. So how can we as a nurse ensure that is who he says he is? You know what I'm saying? So we have a great informant.
Use the patient's.
Exactly.
And with the side rail being down, it's okay in this case right now because his family was at the bedside, so it's okay to have, like, not all of them up if his family's at the bedside.
Right.
Typically. But when his son got up and left, then yes, we have a problem because now no one's sitting there.
But do you really want to rely on a family member to ensure your patient's safety?
Well, no. Not all the time, but if they're at
I don't think there's a right or wrong answer to that. I'm just bringing forth, you know, some things to think about. Okay. So, any questions?
Were the meds supposed to be somewhere, or was that part of it? That
Because you guys, it's an admission, right? Okay. So are you going to have everything that you need right there? Okay, one more thing that reminded me, I just want to talk about a little bit when we're talking about safety. So safety is a big concern. You go through, and we have to figure out as nurses, it's our job to do a good medication reconciliation. So he is going to be our informant. So we may have to do some instruction. You have to go home and bring me the bottles. What's your pharmacy? Then you kind of have to play CSI and go through those meds. How many, when was the prescription filled? How many were taken? Because obviously something's up. His INR is normal, you know, things like that. And then, rotating back here. So she calls a doctor to get, or the doctor calls her in for an update. The actual order was for the meds to be given after the CAT scan was completed. So what do we know about receiving an order from a physician? What do we have to do? Read it back. Absolutely. Every single order, whether it's face-to-face or on a telephone, we say, okay, Dr. Steele, I heard you say X, Y, and Z. And he'll say, well, no, I said Z, A, B, and C. Or, whatever it may be. So that is our job to prevent errors from occurring, okay? And that's a little one. Give it before, the pharmacy's not going to bring it anyway, but say he threw up in the CAT scanner, right now he's NPO, you know what I'm saying? That there may be a method to that physician's madness as far as waiting until after the CAT scan is done, that he's going to be laying flat for a period of time. So, that's all I got.
Okay, that's fine.
Okay, so if you can, we'll figure out about this IV bag here, and then I will, you guys can come and sit back here with me and kind of watch the next group. I have a little tool that I want you to use. Now that you know the story, you can kind of watch and see what they're doing, thinking safety and all those things.